Well, we're going to start. We're very honored here to have Congressman Pallone here, who's been a leader in Washington regarding health care issue, which is in the purview of the committee that you sit on and chaired for a number of years, and hopefully we'll be chairing again soon after the election. I would like to now acknowledge some of the officials who are behind me. We have 4th Ward Councilman Michelle Lombardi, at-large Councilwoman, Council President Gabrielle Cahill. We also have Councilman Frank Ern from Ward 1, Pastor Rouse from at-large, and then who else are we missing? We have Reverend Kenny. Everybody knows Reverend Kenny. We have Assemblyman Egan, there from New Brunswick, and Senator Smith, and I'm not sure. Anne Marie Hill. Okay. Oh, Sharon Carmichael. Come on, Sharon. Come on up. It's Sharon Carmichael. So we're one of the initiatives that I believe that the congressman's going to be speaking about. As you all know, through the recent legislation that was signed into law by President Biden, allows the federal government to negotiate drug prices for Medicare. However, it's not allowed, I believe, Congressman, at this point for private insurers to negotiate. And that's what the legislation he's going to speak about. We're very fortunate enough now, those folks that are on insulin now have more consistent costs now, insulin, where it's not bankrupting your bank account to pay for the insulin shots and many other drugs now. But I'm not going to get into the weeds on this. I'm going to have the congressman speak a little bit about that. And I know we're going to have a couple other people speak about that. Okay, so Congressman, take it away.
Thank you, Mayor. Thank you, Mayor. I always like to come here, not only because we always have a great audience, but also because I can thank the mayor and the council and also the senator, assemblyman for all the work they do for seniors. I love coming in the building and I see all the different things that you're doing. Every time there's something new, right? There's that whole board out there about all the different things that you're doing here at the senior center, and it's certainly one, if not the nicest senior center that I have in my congressional district. It also seems like a lot of you actually listen to what we have to say too, which is always nice. You're not just potted palms. You're actually listening to what we're saying, which is great. But anyway, I wanted to talk about something probably most of you are familiar with now that we did with regard to Medicare and prescription drugs. And then I wanted to explain how I'm hopeful that we can expand this to the general population. And there's no reason why it shouldn't be. But the program for seniors under Medicare already exists and is gradually unfolding over the next few years. And I'll get into some of the details, but not too many. But I want to give you a little bit of the details of what we're doing. So all this was done under the Inflation Reduction Act, which was a bill that we passed when the Democrats were in the majority and under President Biden, Vice President Harris a few years ago. But it takes a few years for it to unfold. So as the mayor mentioned, some of the things are already in place, right? So the $35 per month cap on insulin is already in place. In fact, in that case, the 3 major manufacturers of insulin have already decided to expand that cap beyond Medicare to the general population. A lot of times when we do things under Medicare, they end up on their own spreading to the general population because, for example, if there's a drug that's negotiated and the price is reduced for Medicare, a lot of times the insurance companies will say, well, I'm not paying more than that Medicare price. Why should I, right? And the same thing happened for insulin. So once we capped insulin for seniors, the companies that were selling insulin decided that they couldn't sell it for more than that because the insurance companies wouldn't pay more than that. So this price that we set oftentimes ends up being applicable to the general population on its own without us even having to legislate it. But we're still going to try to legislate it. So as I mentioned, under Medicare Part D, we have this program where prices are negotiated, but every year it becomes a new batch, if you will, of drugs. And the first batch were just announced, 10 of them, just a few weeks ago exactly. And I'm not going to go through the whole list, but just to give you an idea, a lot of these drugs are advertised late at night, and I see them on late night TV, right? So I'm going to use Jardiance. Isn't that the one where they dance? Yes. They dance. Yeah, I know. Exactly. I shouldn't laugh, but it's true. So let's use that as an example. Let's see what we did with Jardiance, right? I think it's pronounced Jardiance. So Jardiance, I'm looking at the list now, is for diabetes, heart failure, chronic kidney disease. There are 1,883,000 Medicare enrollees that use Jardiance. And the list price right now for a 30-day supply is $573. The negotiated price is $197, right? So 66% savings, $376. Now, I have to tell you, these prices don't go into effect until January of 2026, right? So I don't want to get everybody the wrong impression. But next year, but what we do is we start with this, and that was 10. But next year, there'll be another 15 and then 20, right? So we're already starting. And what they do is they choose the ones that have the highest cost and the most use, right? So obviously something like Jardiance, a lot of people watch a TV show, right? And they advertise, and so a lot of people use it. So it's one of the ones that has the highest list price, but at the same time is most in use. And that's true for the first 10, okay? That's the main thing I wanted to explain. I mean, once this goes into effect for those 10 drugs, Medicare will be saving about $6 billion annually. So, I mean, it's a huge savings. And then that money gets pumped back into other programs for Medicare. Because some of you have actually said to me over the years, well, I'm worried that Social Security and Medicare is going to go broke and there's not going to be money in the trust fund. Well, when you save that money, then it allows you to do more under Medicare or extend the life of Medicare in the same way it would for Social Security. So I'm not going to list all the drugs, but as I said, there'll be 15 more next year, then additional 15, and then 20 drugs each year after that, always the ones that have the highest price and the most use. The other thing that I wanted to say is that is the $2,000 cap on out-of-pocket costs, right? So right now, as you know, over the years, we have this donut hole where if you reach a certain level, then you don't pay any more co-pays or co-insurance, right? But right now, that level is still about $3,300, right? That catastrophic level where you're not paying any more co-insurance or any more co-payments. But beginning in January of this year, not this year, January of 2025, that will be capped $2,000 annually, okay? Which is significant too. The other thing that's already in effect is the inflation rebate. And so part of this bill that we passed was signed into law says that if a price goes up, of a drug goes up more than the cost of more than inflation in a given year, then that difference has to be rebated back to the Medicare program. And then that has to be used in order to reduce co-payments and co-insurance. And that's actually in effect now, that rebate program. And I've got all kinds of statistics here about how much money we save on this, but I don't want to go into that now. What I do want to go into is the fact that what I'm trying to do with this new bill, right? Now, this isn't going to happen in this session of Congress, but in the next session of Congress, hopefully, as the mayor said, the Democrats will be in the majority. And the president and Kamala Harris, the vice president, the Senate leaders and the House leaders all support essentially expanding what I just explained to you to the general population, right? Because now everything is only under Medicare, but we would like to extend it to the general population. And that would mean everything would be those same prices would be applicable to everyone. We also would increase the number of drugs that would be negotiated every year. So it wouldn't just be 10 or 15, it would go up. And the inflation rebate would apply to the general population. Essentially everything I discussed would be applied to the general population. So, and to some extent, this may happen on its own, as I said with insulin, because I can't imagine that if you're an insurance company and they know that you're paying, what do we say for Jardiance? It's $179, that you're going to say, well, you're going to charge me $500. I just don't think they're going to do it, right? Because they're going to say, wait a minute, that's the price. I'm not paying more than that. But this bill would say that the price would apply to everyone. And it's, I think important that we do that legislatively as well. So that's what I wanted to talk to you about today. And now I'm going to go to your own state senator, Senator Bob Smith. And you should know that Bob has also been involved over the years at the state level in doing a lot of the same things for seniors, expanding healthcare options, trying to reduce costs, because we all believe very strongly that the biggest issue for people is affordability. That people just can't afford things, and prescription drugs is a big part of that affordability agenda. So, Senator?
Brevity. Don't eat up the clock. And the brevity is that we're blessed. We're blessed having a congressman in this district who cares about everybody, but seniors in particular. And this drug initiative is one of the strongest things I've ever seen watching the national government for at least 50 years. I mean, this is on the order of Franklin Roosevelt, doing the right thing by people and helping them to live a great life. That's where all Social Security comes from and other good programs. So Congressman Pallone's doing the job for us, but you have a very important November 5th. And please do the right thing for yourself and go vote. God bless you all. More drug work, please.
But I do want to stress that the state legislature, Kevin is not going to, Kevin Egan, your assemblyman, he's not going to say anything. But I'm going to say something for both him and Joe Danielson, who's the other assembly person you represent, and Senator Smith. When I talk about affordability, I'm today primarily talking about prescription drugs. But you know that on the state level, they've been doing so much, with the property tax, what do you call them? Anchor. Between the programs for seniors, to rebates, and for property taxes to try to reduce property taxes for seniors and for homeowners. And this keeps getting better every year. So, they're very conscious of the fact that they need to help not only senior citizens, but people in general to afford things, because that's really the number one issue, whether it's prescription drugs or it's property taxes or whatever it is. So I just want to thank them for that. Now we have some people here that are directly involved over the years, not only in this negotiated prices for prescription drugs, but trying to expand health insurance and lower costs for health care. And first I want to introduce Laura Waddell, who's the Healthcare Program Director at New Jersey Citizen Action.
Sorry. Good morning, everybody. There's a saying, so goes Medicare, so goes the rest of us. And we applaud Congressman Pallone for championing the Lower Drug Costs for American Families Act, because it really builds on the progresses achieved in the Inflation Reduction Act by bringing more health care affordability measures to more families. The act, as the congressman explained, extends the Medicare negotiated prices. It increases the number of negotiated drugs, as well as applies the inflationary caps to all Americans who are covered by private health plans. And by extending these benefits to the rest of us, not only seniors can benefit from lower prescription drug costs, but millions more will be able to as well. The Medicare negotiations have reduced the list price of the 10 drugs, as the congressman mentioned, by hundreds, and in some cases, thousands of dollars for 30-day supplies used by millions of people on Medicare. And savings are expected to total, as we heard, $6 billion for taxpayers and $1.5 billion overall for Medicare recipients. And by expanding these savings to the rest of us, those numbers increase exponentially. Everyday people, like your children and grandchildren, neighbors and friends, also need drug pricing reforms like these. Because everyday people that are paying the price for for having to choose between paying bills or taking their life-saving medications. This is the everyday struggle that continues at the pharmacy counter. And this is why it's so important to not only support efforts at the federal level like this, but also at the state level, as with our New Jersey Prescription Drug Affordability Council, and expand affordability to more of us. And it's equally important to continue to defend what has already been established. A New Jersey study released last year showed that almost 90% of us across party lines are in favor of measures from our policymakers like this that would standardize drug prices as negotiations do in order to make prescriptions more affordable. We need to call on Congress to pass the Lower Drug Costs for American Families Act and send the message to Big Pharma that time is up. No more price gouging Americans. We need the real reforms this measure will bring. We need to stand with Congressman Pallone and urge the rest of our New Jersey congressional delegation to support expanding prescription drug affordability to more New Jerseyans so they can bring the same historic prescription drug pricing reforms from Medicare to the rest of us. Thank you.
Thank you, Laura. Now, we also have a representative from the SEIU, which is one of our major unions, and unions have been very supportive of this initiative. And that's Anna Maria, who's with 32 BJ SEIU. She's the state director.
Just gonna push it back so it doesn't vibe. Is it that's vibing? Okay.
Yeah, it's okay.
Good morning. So my name is Anna Maria Hill, and I'm the state director for 32 BJ. We are a labor union, and we represent over 185,000 members throughout all of this country. 15,000 of those members work here in New Jersey. And these are janitors, security officers, cafeteria ladies. They are your baggage handler folks, and they are your concierge and your porters in the residential towers. And the one thing that they all share in common, they are working people trying to maintain their families, trying to achieve the American dream. And the one thing that they have, and the reason why I'm here, is because they live in fear that there will be one surprise hospital bill, one unexpected diagnosis, right? They'll be diagnosed with diabetes, they'll be diagnosed with something, and that diagnosis or that hospital bill will strip away the American dream and send them tumbling into bankruptcy. And so that is their biggest fear, and that's why I'm here today. And I want to thank Congressmember Pallone for his fight for working families, for his fight to ensure that we don't take advantage of, right? And so the rising cost of healthcare continue to grow exponentially. As a union, all of our members have employer-paid healthcare, so they do not pay for their family healthcare. And that makes it even harder for us when we go and negotiate for their bills and for their contracts. It means that when we're negotiating and fighting for wages, that rising cost of healthcare takes more of the money than their actual raises and how they maintain their families. And so having that bargaining power that Congressmember Pallone is talking about is really important to what we're doing. And when we looked at the cost of healthcare and the cost of what's going on with the health fund, we realized that the number one thing that is driving the cost up is the price of hospitals, of course, but not far behind it is the price of medication. It is the pharmaceutical companies that are just driving up that cost. And so in 2023, prescription drug benefits accounted for 18% of 32BJ's health fund spend on medical benefits for members and their families. And so we wholeheartedly support the Inflation Reduction Act's medical drug price negotiation program. And we support creating additional pathways for negotiating lower price drugs in the commercial market. 32BJ applauds Congressmember Pallone's proposals in the Lowering of Drug Costs for American Families Act to extend Medicare drug program negotiation programs and apply prescription drug price negotiation abilities will give employers and unions like 32BJ another critical tool to provide affordable prescription drug coverage for our members and their families. We are also big supporters of price transparency at both the state and the federal levels. New Jersey already passed legislation last year providing more oversight and data transparency to pharmaceutical prices. And we are currently fighting to create more oversight and data transparency over hospital prices at the state level. When I talk about transparency, I'm talking about if you're going to go to one place to get a hip replacement, do you really know what that costs? And do you know what this other hospital here is going to charge you? You don't. You don't until afterwards. And as consumers, right, in this country and in this state, we should be able to know what things are going to cost us so that we can plan for it and so that we don't have to worry about, that one bill that's just going to spiral us into bankruptcy. And having fair negotiations and transparent prices across all healthcare sectors is the core to our mission and our ability to support our members. And so thank you, Congressmember Pallone, for continuing the fight to make sure working people across the country have access to health care and to affordable prescription coverage plans. Thank you.
Thank you, Anna Maria. So I think we just have one more speaker, last but not least, certainly, and that's Reverend Henry Kenny, who is one of the group, I guess, because he lives right next door, right? All right. Would you come up, please?
Good morning, all. It's good to see all the seniors out this morning, and those of you who are not yet seniors, but one day you will be. And thank Congressman Pallone, Senator Smith, and my illustrious mayor, Brian Weiler, for allowing me to be here and to talk to the seniors. I speak about it in my church at Christ United Methodist Church quite often about things going on for our drug prices and so forth. And I'm happy to say that Congressman Pallone, he's the one who instrumented these things and these prices, the drug prescription prices for these multi-million-dollar drug companies. This means affordable money for each and every one of us, more money back in our pockets that we can save as seniors. And we know we need our dollars. We don't have too much money as it is. Some of us probably don't even have enough money to even buy drugs and drug-related things. In regards to this, but thanks to Congressman Pallone, that he got this bill signed by our president, President Joe Biden. And he proudly stands behind these things so seniors can live today. He got the new bill signed for drug costs for American families, not only for the area and state of New Jersey, but it's for everybody in all our states. First, he was going to increase the number of prescription drugs that Medicare can negotiate. Then he's going on to bring lower prices for families and their health care insurance. Dealing with insurance companies, they don't want to pay so much money. They'll say, well, this is the price and this is the price we want. They become billionaires over and over again. We can all be proud of this bill, that we can see a sea of change for the American people in drug prices and lowering our costs. I know myself, I go to CVS, I'm not lifting up CVS, but my price for my drugs have gone down. For my heart, I pay zero for my prescriptions now for some drugs. And this is a good thing. It's a big savings. So we can be proud of the work that he does in Congress and getting this job done for seniors, not only in the state of New Jersey, throughout this country. So Congressman Pallone, we thank you. We earnestly, and don't forget, my beloved, when we go to the polls, do the right thing.
We're done, but we'd like to have, I'll thank everybody, obviously, and thank all of you, and thank the mayor in particular. But if you have some questions, go ahead. Yeah, Pam?
Leo?
Yes.
What about the SALT deduction for New Jersey homeowners?
Right.
That was taken away from us from the former president.
Yep.
And we'd like to get it back. We'd like to be treated the way every other state is treated.
Well, we have, that bill. I call it the Republican tax bill because it was Trump's big deal, right? That took away the unlimited salt reduction. So in other words, I don't want you to think we're talking about salt, right? We're talking about the fact that you traditionally, when you paid your property taxes, you could deduct, when you paid your federal income tax, you could deduct your local property taxes, your state sales taxes. SALT stands for, I don't remember, but state and local taxes, yeah, SALT. So what happened was the Republicans came in with Trump and they capped that at $10,000, right? In order to finance big corporate tax cuts, right? Which I don't think helped anybody because a lot of times the corporations just took that savings and, spent it overseas or invested it overseas. So that expired, or there's stock buybacks, dividends. So anyway, that expires in 2025. And so what we're saying is that if we're in the majority, if Democrats are in the majority, if we have a Democratic president, we will bring it, and we do a new tax bill. Our tax bill will guarantee the full SALT deduction, right? And if anything, if we would raise the corporate tax, right? And then we would plow that money back into a tax break for middle class people. Just the opposite of what the Republicans did. But it does expire. So theoretically, if we did nothing, right, by 2025, the full SALT deduction would be back in place anyway. But we're saying, and of course the Republicans are saying that they'll reenact it and they will give a bigger corporate tax deduction. So, it's a big issue for the campaign, but it will actually expire and go back to the full deduction if nobody does anything, which would be good. Yeah, go ahead.
This is not a question, it's sort of a suggestion. I'm very much into holistic eating. And I have a granddaughter that's a food Nazi that makes it even worse. Grandma, don't eat it. I think if there was more control on the food additives today, we wouldn't have as many children that have issues in school with their, attention deficit disorders, etc. If there's more government control with the food industry, pharmaceuticals wouldn't charge these exorbitant rates to handle the conditions that are caused by the food industry. I'm in the grocery store and somebody's picking out cottage cheese. I said, look for the carrageen, and it's not a good thing for you. I'm this crazy lady.
It's good that you look.
Seriously,
Yeah.
that these are things that are so important that, and the spraying of all these things of food, genetically modified, are causing so many unnecessary conditions in our kids today that I wish our government, if there's more interested, put into it. I'm gonna dance at 100, so I ain't eating that crap.
All right, so you won't have to take Jardians then. You can dance on your
And
own.
that's another one.
I'm
The
just being bad.
Jardiance commercial, why don't they just say it's a Weight Watchers commercial? It's not for the, that really freaks me out, that one. Well, dancing, because they're
I'm
fat,
sorry to
they're
bring it up.
taking the diabetic drug.
It's just they do so much advertising. It's hard not to notice it.
I just think it,
But there's two aspects to what you raised, right? First of all, it's in my committee, and so we have a number of bills that we're trying to get at some of these additives. But there's two aspects of it. One is to just outlaw some of these additives if they're dangerous. The other aspect is to have better labeling so that somebody like you can shop and see what's in it. So we're approaching it from both angles.
At the European Union would never allow the crap to give their patients like we do in the United States.
They're much more progressive in that respect.
Much more progressive.
That's true.
And it blows my mind.
But we're looking at it from both angles, to either have some better labeling or to just outlaw some of these
I
things.
think a lot of it has to be outlawed because it's
Yeah.
just downright bad.
All right. Go ahead.
Congressman, I have two concerns. The first is the price gouging by the food industry. I know the president's been trying to address this, but it just keeps getting worse as these big conglomerate food companies become more and more powerful. I remember back in 2021, Tyson Food made $1 billion in the first quarter at the same time that they were doubling and tripling prices on chicken and eggs. This is really hurting the poor, working people, especially the working class working people, it's hurting American families, has got to be addressed. And the other concern I have is the longevity of Social Security, and I'm hoping that at some point you can get a bill that would raise the rate of income that is taxed for Social Security, so we can extend that and look forward to not having to worry in our advanced old age when we will not be able to fend for ourselves.
Well, with regard to Social Security, there are really kind of two things out there that we've been looking at. And again, it's not my committee, but it's something that I'm very concerned about. One is the COLA, right? To revamp the COLA so that it's more reflective of actual prices that people pay for food and housing. That needs to be changed. And then, also looking at the tax on Social Security. A lot of things now that, people pay tax depending on their income on the Social Security. There's also the windfall tax, that certain government employees pay, that reduces their Social Security. So we're going to take a look at those things. With regard to the groceries, I know that the Vice President made an announcement about trying to reduce costs at the grocery counter. But at the same time, a lot of this, you mentioned Tyson's, isn't necessarily the supermarket making the profit, but it's rather the supply chain, right? And so a lot of those increased costs have come through increased prices at the farm. You mentioned Tyson's with chicken. And so, there are things that we can do to try to reduce costs along the supply chain as well. It's not just the supermarket, it's also the supply chain that we're looking at.
Well, that is an urgent issue
Absolutely.
for American families, and it's definitely going to impact this election if it's not addressed. And it
Oh,
doesn't
absolutely.
exist.
No, I know. All right, one more? Go ahead.
My query, where can we get a list of
That's what I was gonna say. What drugs are
Okay,
included?
good.
Thank you.
Oh, you want the drugs that are...
Yeah, that would be great.
All right, well, I have it here, but if you, what do you want to do? Send it to
I'll tell you what,
Jane?
Congressman, what we could do is, the congressman's staff can send it, and we'll give it to Amy, so we could distribute it in the building.
Yeah, we'll give
All right?
it to you.
Is
Now,
that
but a
fine?
word of caution now, this is announced, but it doesn't take effect till 2026. The actual price negotiations, the $2,000 cap takes effect January 1st. Inflation reduction is already in place, so some of the things have different dates, okay? All right. Well, thank you all so much.
Thank you,
Mayor.
Congressman,
All
for
right.
coming out.